Welcome back again on Breaking the Silence podcast. With me, your host, Victor Campani. We always talk about the issues on the health. Issues about health is not a thing we should not take simple, but we take it as a serious business. So we have the guest here, and we're going to talk about this topic in our discussion. So don't forget to subscribe, share, and comment. Yeah, Mr. You are welcome.
Thank you very much.
Yeah, can you introduce yourself to the people so that maybe they can know you?
Okay, my name is Shukran, but should I just mention my name or I should add up some information?
Maybe like your status, who are you?
Okay, my name is Shukran Robert, as I have already said.
Yeah.
And as you can see, this is the place where I work as a medical practitioner.
Yeah, I can see. There's a lot of
Of
stuff
course,
here.
I'm not the owner of this building,
Yeah.
but I am just an employee.
Okay, fine.
Yeah.
Okay, fine. Today we're going to discuss about the technology and health. So,
Yeah.
nowadays now it's full of technology.
Yeah.
So,
Technology everywhere.
yeah, it's everywhere. So, can you tell the people how technology is related to the health, in short?
Okay, you want me to relate health and technology? Okay. In short, I can just say that technology is mostly related to health because most of things nowadays which are relevant to health,
Yeah.
they involve technology. To simplify those processes, we can say, we can give examples of X-rays.
Yeah.
They use X-rays to scan the inside of the bodies of people.
Yeah.
Yeah. So this is part of technology. So I can just say that they are predominantly related.
Yeah.
When we are to compare these two things.
You're just mentioning only one. Can you?
It is just an example. You told me to relate these two things, so I just gave an example so that people should have insights of what we are talking.
So can you give at least a scenario of a couple of examples of these technologies?
Okay, you want me to give examples of technological things that are being used in the health sector.
Yeah.
Okay. We have diabetes.
Yeah.
We have diabetes. So scientists came up with devices which those people who are infected by diabetes use to measure the level of sugar. They use those devices to measure the levels of sugar so that they consult medical help in time. By using those devices, these devices are part of technology.
Yeah.
I can give another example of coronavirus. When entering public places like banks, they used a certain device to scan us on the
temperature of the patient.
Yeah, so it's part of technology.
Yeah,
you understand?
Yeah.
So I can give a lot of examples.
Yeah.
But those are just a few examples of technological things that are being used in health sector.
Okay, fine. You have talking about at least the measuring or diagnosis of some issues in the body, like temperature, whatsoever.
Yeah.
So, can you tell the people what are examples of the technology can be changing in the way healthcare professional work as related to the ways of providing services, the technologies? Because you have just talking about the coronavirus, the machines where we are using it for sometimes. So there is any technologies or even the machines which are being used for the testing of the people according to the status, even the temperature, as we have said already.
Yeah, there are a couple of examples.
Yeah.
Understand? I will give also an example of expectant mothers.
Yeah.
They go for checkups.
Yeah.
Understand? Sometimes they visit doctors to check if they have twins in the stomach. Understand? they use technology to scan those things because it is inside.
Yeah.
You can see with our naked eyes. Yeah. So they use X-rays to scan what's inside our bodies.
Yeah.
Maybe accidentally you consume something which is bad to your health, like metals. I remember back then, my fellow students at primary used to consume like these coins, 10 quarter, 5
Yeah.
So the only treatment which was there was scanning them and doing surgery. So surgery is also part of technology. They can pretest on your own.
Yeah.
Yeah, so I think that's what I can say on how technology is being used in health.
Okay, according to the way you have explained it, we are relating on the health of the person, even health as a whole, and technology. So, we can't say that these things, technology is almost have benefits. Maybe there is some circumstance, we can say that there is some limitation
Yeah.
this technology brings to our health. So, can you tell the people what are those limitations?
Okay. I will include technologies relevant to health or others which are not relevant to health. For example, we have these our phones.
Yeah.
Yeah, these are part of technologies.
Yeah.
We have TVs, part
Indeed.
of technologies.
Yeah.
You understand? So when someone is exposed much to the light of the phones,
Yeah.
they can cause problems with their eyes, to their eyes. You understand?
Yeah.
The same as to watching screen or TV
Yeah.
frequently, they can have problems with their eyes. So I think these kinds of technology, although they are not relevant to health, but they can bring some disadvantages or dysfunctions to our health. So an advice, we should just make sure that we are not frequently exposing our eyes to the light of the screens
Yeah.
and the like, so that we ensure that our health is at a better position.
Okay, fine. You have talking about on how the people should conduct their things in order to avoid those limitations. So, this machines is very suitable, is vital for our investigation of our body. So, can you tell the people, although these machines they are more essential for our daily activities when we go to a hospital in such investigation, even the diagnosis of the some diseases. So, can you tell the people how, in detail, how this technology can be used to avoid such things?
How technological things.
Although there is certain benefits to use these machines, but there is some limitation. So, to backbite these things, how they can use these technologies to avoid those limitations? In detail, can you tell the people? For example, you are talking about maybe you have talked about television, but people must watch television in their homes.
Obviously.
We must use our phones because we find that sometimes you have the message from the work.
Yeah.
We use the phone. We have some issues which we go through our phones. So it's something
like,
which is complicated. So can you tell the people?
These devices, I mean, these devices have become part of our lives.
Indeed.
Yeah. So, yeah, definitely it is difficult to put them aside. So, on how they should use these devices to ensure the betterment of their health,
Yeah.
I think I already mentioned that on the advice I provided on how to use these devices. They should limit themselves from exposing their eyes into looking at these devices because the light can cause a lot of problems like eye problems and the like. And also data. The data we use to get access to internet,
Yeah.
there is an involvement of radiations, some radiations. That's why some experts advise us that when we are sleeping or when we are doing everything, we should not put our phone while data is on. We should not put our phone close to our skin, because there is an involvement of radiation. So radiation, you know, it has great dangers that it can bring to our life. So indeed. I think these are some of the things that people should take care. They should be cautious of these things so that their health should be at a better level.
Okay. Yeah. So I just want you to tell the people. So, what role does the wearable devices play in monitoring personal health?
Okay, monitoring devices is also part of technological things that have been invented in health, in the health sector. We have a number of wearable devices. So the first device is smartwatches. You know the smartwatches, those watches that have been advanced. Those watches, they measure heartbeat. How is your heart beating? How fast is it beating? They also measure blood pressure. How is your blood flowing? So these things can help in knowing if either you are good or you are not good. You have to consult a doctor or a physician. So another device is health monitor. On health monitor, we have devices that measure blood pressure. Also, it functions the same as smartwatch, but the main function of this device is to measure blood pressure. How is your blood flowing? You know, blood pressure is something which you cannot take for granted. People die due to high blood pressure, and it is common among our elders. So by using these devices, they simply know how blood is flowing in their body, so that they know the time to consult a doctor, or they know to relax. They know the time to relax. So these devices are more relevant to our health, and they have brought simplicity in terms of health monitoring.
Now the doctors, you are working free because of this technology.
You understand? We are not being busy monitoring these patients. They are able to monitor themselves using these devices, measuring their heartbeat, measuring their PT, measuring their levels of sugar, whether it be low sugar or high sugar. They are using these devices. So I can say wearable devices are playing a crucial role as long as health is concerned.
Okay, according to the way you have explained, can this technology help to manage chronic disease?
Yeah, of course, definitely. These devices, not these wearable devices,
but
there are other technological devices that are ideal as long as chronic illnesses are concerned. I can give an example. One chronic illness, which is asthma. They use an inhaler. Inhaler is part of technology.
Indeed.
Back then, people used to inhale weed. You know weed? Jamba in our local language. They used to inhale weed so that they can cure from asthma. But it isn't a permanent treatment. Although it is more crucial to our health, it is not a permanent treatment, because these are chronic illnesses, long-term illnesses, as the name suggests. So these inhalers provide good treatment, which is also better for our lives. Unlike using chamber to heal ourselves, it can cause a lot of effects. Lung cancer, because when you talk of chamber, it has an element of nicotine. Nicotine is very dangerous as long as our health is concerned. So the invention of inhalers brought great change, and which is also important, significant to our health. So I can give this only example that chronic illnesses, there have been invented a lot of devices to overcome or to minimize their dangers.
Okay, fine. We have talking about the technology, how it is being useful for the chronic diseases, and you are talking about asthma. So, can these technologies can be used to track or to prevent diseases or any outbreak?
Yeah, of course, definitely. Technology almost encompasses every sector
Yeah,
in the world. I can say in the world, according to my perception.
yeah,
You understand? And according to your question,
yeah,
you know, we had coronavirus pandemic.
yeah. Last time,
Do you know that that pandemic was recognized by us Malawians before it ventured into this country?
okay.
I'm telling you, this is the truth.
So yeah, we just heard on TV that there is a
There
coronavirus.
is a disease which is spreading rapidly in
Yeah.
China.
Yeah.
That was on TV before the disease ventured into our country.
So they use this technology to
They use
identify it.
these technologies. How rapid is it spreading? How is it spreading? How can we prevent it?
Yeah.
They all used these devices, technological devices,
Yeah.
to know how to overcome this disease. Or of course, it was not permanently cured because the main cure wasn't invented yet.
Yeah.
But they managed to track and tell us the things to follow in order to manage to escape from the dangers of this disease. They use technology.
Yeah, indeed.
And also Ebola. We just heard that there is Ebola. It is being spread by this, it is caused by that. They all use these technological things.
Investigate what causes it.
Yeah.
How this
Before it
spread.
ventures into the lives of people. And also we have heard that there is a certain disease. They are calling it chickenpox.
Yeah.
Chickenpox.
Yeah.
Before people get infected by the disease, the scientists already managed to come up with solutions to the problem.
Using this machine
Technological advancement. We also have a certain disease, I don't know, I've just forgotten the name, but it is caused by mosquitoes.
Yeah.
It is just a current issue.
Yeah,
It is a current affair. I was just scrolling on YouTube, Facebook. I just saw this news that saying that there is a disease which is strange to us, and it is being spread by mosquitoes. We know mosquitoes are spread by, mosquitoes spread malaria.
Yeah,
This is a definite thing. But we just heard that these same mosquitoes are spreading this disease. I've just forgotten its name. So how did we know that this?
technology.
Yeah, definitely. So I can say technological devices are crucial as long as tracking strange diseases before venturing into our country, before venturing into our communities, before venturing into our households. We use these technological devices to track the diseases so that we find solutions to them. I can say they are playing a crucial role.
Okay, fine. Although this technology is like the way you have said that is playing a crucial role.
Yeah,
But what are some challenges to development country face to access these healthy technologies?
Yeah, that is a very, very good question. You understand?
Yeah.
Because when you say developing countries,
Yeah.
it doesn't mean they are already developed.
Yeah.
They are in the
Talking about
process.
Malawi.
They are in the process of developing. We have a number of countries which
Yeah,
are
indeed.
not developed, but they are developing countries. Malawi is among those countries.
Yeah, we are among them.
Yeah, we're among the countries. And also we have developed countries, those countries who are totally independent. They rely on themselves. They have industries. They create, they come up with their own medicines.
Yeah.
Whenever a disease is recognized that we have a disease, so they use their scientists because, but out there, education is something which is highly valued. So they have a lot of scientists who know their way. So as for your question, developing countries can't manage to buy these devices which can be used to mitigate different diseases as long as technology is concerned.
Yeah.
We can give an example of cancer treatment here in Malawi. We don't have a permanent, we don't have a permanent hospital which can be used to cure cancer. Everyone who is found with cancer is sent to outside countries like China, India, because they have adequate resources to heal those people.
Yeah.
Why they are developed countries, not developing countries.
Yeah.
We have not yet reached the level of being independent, of relying on our own, of coming up with medicines. We don't have scientists who can invent new ideas to come up with solutions to our problems. Yeah. So whenever a problem occurs in our country, because we are developing, we fail to mitigate those problems because we don't have adequate resources.
So you have talking a lot of things about the examples.
I was elaborating so that people should not come up with questions.
That is, which is essential. Yeah. Okay, you have talking a lot of things like there are devices which is very unique for the usage of medication and usage in our hospitals. Sure. You have talking about the challenges. You have talking about the how the people can use these technologies in order to avoid some
we also don't forget we also included wearable devices.
Yeah, wearable devices.
Because other people are using smartwatches just for flamboyant reasons. They are just taking them as fashion.
For fashion. Like the way I have put my watch.
Yeah. But this one is not a smartwatch. You can fool me. Understand?
Okay, but this is the way we are doing with our podcast. The title of our podcast is Technology and Health. So before we conclude, can you tell the people just to highlight all the things you have talking about, how they can use these technologies? It's like we are reminding each other.
Like a recap, summary of what we have discussed so far.
Yeah.
Okay, first we are talking of what? Diagnosis.
Yeah.
So we should be keeping in mind that we have technological devices which are being used in a proper way to come up with solutions to our problems we face in our day-to-day lives. So I just advise them, I urge those people who underestimate health devices, especially health technological devices, that they are not 100% reliable, that they should first, before coming up with their insinuations, they should first study, they should scrutinize how these things work so that they have total insights of the importance they have. You understand? Yeah. I think I don't have the energy to mention all the advices to those people because they can just restart watching the episode. You understand?
Yeah, indeed.
So for their own betterment, they should just restart watching the episode so that they understand what we were discussing in this episode. You understand?
Okay, fine. This is our max end of our discussion today. We were talking about the health and technology. Until next time, you watch the next episode on Breaking the Silence on the Health podcast with me, your host, Victor Company.
Don't forget, my name is Shubran Robert. Maybe someone is just scrolling and you have to understand that I was the guest of this episode.